came in with a really bad ingrown nail. Bad enough that the pus has been draining from the side of the toe, and the toenail's been digging in for so long that it's formed granulation tissue. And granulation tissue is this beefy red tissue along the side of the toe. And what happens is it gets thicker and thicker because the nail is constantly jamming into the side of the toe, and the body tries to protect itself by putting more tissue there. And it's also a reaction to the continuous trauma on the side of the nail. So in addition to taking the side of the nail out, this piece of the nail, I'm gonna have to remove this granulation tissue, clean it off, and then cauterize it with silver nitrate. So it'll heal real nicely and look really great after it's healed and look like a pretty normal nail. So I'm gonna put a tourniquet on this, and this actually may cause some of that granulation tissue to open up, bleed, and drain a little bit. We'll see once I open this up. And this is gonna be real tight around the toe. Acts as a tourniquet, it pushes some of the blood out, but even though I'm putting this on his toe, it still will bleed quite a bit. I'm gonna grab a pair of scissors here to cut this. And we'll cut around the other side. Okay, so it did not break. Now we're gonna open up the side here so we can see how deep this nail is going in. And we're gonna free the side of the nail that's digging in. So you can see the granulation tissue is cloaking over the nail itself. You see how much tissue there is here? And that's all cloaking over. So I'm gonna go in on the side of the toe here to free this up. And underneath the side of the nail, this frees it up. A lot of it is already slightly free because the infection has pushed it away from the nail bed itself. And right now I'm freeing it off of the nail bed. And I'm only gonna take a portion of the nail plus a little bit more because when he stands down, the skin is gonna wanna move over towards the nail itself. And here you're gonna see some pus, some drainage, some bleeding, and the granulation tissue tends to bleed a lot. It's pretty vascular in nature too. And that's because it's reacting to the continuous trauma on the side of the toe. Let me free this up here. So I'm gonna now take a portion of the nail that I want. I'm gonna move this over and I'm gonna kind of guesstimate here. You can see where the nail ends there. I'm gonna take a little bit more. I'm gonna clip it here. And then I'm gonna clip in towards the nail matrix. The nail matrix is right where the end of my English anvil is. That's the name of this instrument I'm using. And that's how far I'm gonna kill the nail bed. So it's actually killed all the way up to there. That gives him room for healing. So the side of the tissue and the skin will just kind of move over towards the edge of that, of the nail. So now I'm gonna take a hemostat and actually get the piece of nail out. So I'm clamping onto it right now. And you can see I'm clamping out and I'm gonna slowly pull this out. I'm gonna twist it and pull. And there's the piece of nail coming out of there. Pretty significant. You can see the portion right here to the right, my right, of the hemostat is actually all the portion that was growing in. And that's what's digging into the side of the toe, causing the constant trauma and also causing all that granulation tissue to form. So we're gonna explore this right now and see if it's clean in there, and it looks pretty good right there. So now what we need to do is actually get this granulation tissue out of there. So what I like to use is a tissue nipper. And this gets a little bit bloody when we do this. So I'm gonna kind of keep it even with the margins of the skin itself. And I'm actually going around this area right here. And you can see it kind of comes off by itself in a way too. And it's already demarcated itself. So I can get the whole chunk off of here. Then I'm gonna clean up the rest. And this is the chunk of tissue right here. I'm gonna set it on there so you can see what it looks like here. It's a big chunk of tissue that's formed there. And if you look underneath it, you can see this is where it's real, where it bleeds a lot. It's real vascular in nature there too. So this is what we have to cauterize. So I'm gonna clean this off here. And now I'm gonna just clean all this up as best that I can. I'm getting all this dead tissue out of here. And I need a new 4x4. And I'm doing a lot of this too. I'm trying to feel what feels even and what's not rough there and what's not sticking up. This, believe it or not, when this heals, is gonna look real nice because it's gonna be nice and even with the toe. A lot of this is just dead skin and skin that's been traumatized. But your body is real good at healing itself too after there's trauma like this. So now what I'm gonna do, let me flush this off here with some vinegar. And we can see it a little better here. Okay, that gives you a good view of what's going on there. I'm gonna get a little bit more of this dead skin off of here. Some of this is gonna be, like I said, this bleeds a lot here too, and you can see it's wanting to bleed it quite a bit. Okay, now I'm gonna put the chemical in to kill the nail bed here, so it won't grow back. I'm gonna do 3 sticks here. I'm trying to keep this as dry as possible as I'm doing it, so the chemical will take. The chemical I'm using, sodium hydroxide. It causes a chemical burn, and it will also cauterize to some degree, but not as good as the silver nitrate that I'm gonna use at the very end. And we're gonna do 2 more sticks here with this sodium hydroxide. Again, as I do this, you can actually see where it's burning the nail matrix itself. But the more wet that it is in there, the less the chemical is gonna take. So I'm still trying to dry this out here as I go. And we usually do these sticks about 5 to 10 seconds each. I can already see, just looking at it, you can see right here, you see where it's that whitish color, that's where it's cauterized there. And we're gonna go a little bit longer right here in the corner. Just a little bit more, and I think we should be done here. And then I'm gonna try to cauterize the side here with some silver nitrate. And this is silver nitrate. This is gonna look like it's black. And this keeps it from bleeding. I'm gonna do 1 more stick there. And as I do this, it actually kind of burns down that dead tissue. This will actually make it heal beautifully afterwards. Because it gets rid of all this granulation tissue that's sticking up. And this is almost like equivalent to almost taking like a match, which I do not recommend doing, never take a match to your tissue, but it is actually just kind of burning the tissue and keeping it from bleeding as much, because these can bleed like crazy once they start walking. So you can see it's now cauterized for the most part. I'm gonna be able to put a dressing on this, and that's what I'm gonna do next here. I'm gonna put a little bit of vinegar first here just to make sure this chemical doesn't keep burning him as he goes here. And then clean any dead skin off of here. I see a little piece of skin hanging out here. Yeah, and it's still gonna wanna bleed a little bit here, so. But for the most part, that's good. Let's take a look. A little bit of oozing is normal. And now we're gonna put some Silvadene cream. Silvadene is a cream that we use that kills bacteria, funguses, viruses. It's almost like a triple antibiotic cream. Well, it is a triple antibiotic cream. And it will also kill the fungus and viruses as well, but it's great after chemical burns. So we put this on here, we're gonna goop that on there, and now I can actually throw a dressing on top of it. We're gonna put a pretty big dressing. Even though I cauterized it, for the most part, it's still gonna ooze. And this patient's a little bit bigger and taller, And when he walks, the gravity is gonna wanna pull all the fluid down there. It's gonna throb a little bit. And as it throbs, it's gonna wanna bleed and ooze a little bit too. So we put a nice compression dressing on this. And that's it. And he'll take this off tomorrow. He's gonna do soaks. We're gonna have him soak in white vinegar and water. It's gonna help clean some of that silver nitrate off of there. It's gonna help with the infection and draw the fluid out of there. And it's gonna look beautiful when it heals in about a month. And we'll come back in about a month, take another